Hey there, welcome to the latest episode of the Sexy Thyroid Solution. I'm your host, Angela Brown. Today I'm going to talk about understanding your thyroid blood test results. But first, if you could do me a really huge favor, if you could go ahead and subscribe to this channel and hit the little bell so that you get notification every single Thursday when I release a new video. And if you're watching this on Instagram or on Facebook, go ahead and like this and share this and tag someone who you think would benefit from this information. So let's go ahead and dive in here. So this is a topic that I really love to talk about. I went through so much of this myself, experienced a lot of anger and frustration around it. So I thought this would be a really great topic to talk about, as well as I am getting ready to release my new guide that talks all about this. So you'll have it all kind of laid out in the guide of what I'm discussing today. It'll all be laid out, all written out for you so you can have it to refer to anytime that you need to. So let me know if you want to get on the wait list for that as well. So first, understanding your thyroid test results. There's a lot that I can talk about with this, but the first and foremost thing that I need to bring up right off the bat is to make sure that you're getting tested for the right things. So it's really common for a doctor to go ahead and get your thyroid checked and say, oh, I checked your thyroid, everything looks fine. You need to find out what they had checked, because a lot of times they're only checking TSH. TSH is very commonly one of the things that they will check. You need to get it checked, like no question, but I have seen so many people, including myself, that feel like absolute crap. Even though their TSH might look normal, they still actually might have a crappy thyroid, might have a slow thyroid, something slowing it down, but they keep being told it looks totally fine. Your results look totally fine because your TSH is normal. There is way more to your thyroid than just your TSH. TSH is thyroid stimulating hormone, and it's what's coming from the brain and basically telling your thyroid to release stimulating hormone. That's why it's called TSH. So essentially, if it's really high, it means that your thyroid is actually slow because it's constantly being triggered to release more. And if it's really low, it means your thyroid is too fast. Unfortunately, I don't like lab reference ranges. I think they're terrible. I think it's not functional. People don't feel good at it. It's really common to see a doctor say your TSH looks totally normal. And then you go look at it and your TSH looks like it's a 5. I haven't had a single person that feels good at a 5. Me personally, my TSH has to be below 1. I will not feel good if it's below, or not below that. It has to be below 1. If it's above 1, I have all my symptoms back. So it is not functional. And so that's one of the other things that I want to talk about is your reference ranges. Make sure that just because the lab says this is the reference range that looks totally normal to the doctor does not mean that it's good for you. So you really have to do your due diligence and investigate your lab reference ranges. So getting back to what you need to have checked. So TSH has to be checked for sure, but what about your other things? So T3 and T4 are your 2 thyroid hormones. You have to have those checked. If you do not have those checked, it's pretty hard to say if your thyroid actually is normal. Now, I will say I have had some people come to me and we do look over their thyroid panel and their TSH and their thyroid hormones actually look really good and they still really feel crappy and have all the thyroid symptoms. So that's when I dive deeper and we look at other things that are causing their thyroid to be slow because it's actually not the hormones that are doing it. However, you still have to have your T3 and T4 checked. I usually get free T3 and free T4 checked. The part of the problem is a lot of doctors don't check that. The other part of the problem is they might just check T4. T4 is typically what a doctor is going to give you in your thyroid medication. So if your TSH looks off, usually if it's really high, they're going to throw you on Synthroid. That's T4 only. T4 is not active. And I say this all the time in my videos and all the time in my posts. T4 is not active. So if you are being put on thyroid medication and you still feel like crap, what are you taking? I guarantee you it's probably T4. T4 is not active. What if you don't have enough T3 and they never checked it? Or they check it and they think, oh, it looks kind of good because, again, they're looking at the crap reference ranges. You have to convert the majority of your T4 over to T3. So essentially your thyroid is going to make about 80% T4 and about 20% T3. T3 is active. So you have to convert a crap ton of the T4 over. If you have a conversion issue, you are going to feel like crap. If you are only getting your TSH checked, you're never going to see if you have a conversion issue. Again, that's why I'm adamant. You have to have a full thyroid panel, and you have to look at other reference ranges. You cannot look at the ones that the lab give you. You've got to have more functional reference ranges. And in my guide that I'm getting ready to launch, that guide right there, I have literally, it's all laid out. I have exactly what you need to have checked. I have the reference ranges that I think are more functional, that make you feel better, from personal experience and just the research that I've done, and why you're getting it checked. Why is it so important? So that's going to be super important to look at is the exact things to have checked. The other thing is reverse T3. This is another one that's really commonly not checked. Reverse T3 happens when you're trying to convert over to active T3 and it doesn't work. And there's a lot of things that can cause an issue with that. So it goes backwards. It reverts backwards. That's why I call it reverse T3. It's inactive. It's not active T3. So you need to know what that's doing too. And you also need to know what your thyroid antibodies are doing. It's very common to see as well as you have thyroid antibodies. Basically means that your body is attacking your own thyroid. I've seen people have elevated thyroid antibodies. It slows their thyroid down, but the rest of their panel looks normal. So again, if you don't get your antibodies checked, you'll never know. That's why you have to have a full panel done. And again, that's what I lay out in my guide. You need to have a full panel done. That's the only way that you're going to understand what is going on with your thyroid. So reference ranges, super important. I talked about that already. You have to look at different reference ranges other than what the lab says. If you have questions with that, reach out. And let me ask you this as well. Have you ever had a full thyroid panel done? Or have you been told that your thyroid looks normal and you feel crappy still? That's what I see happen all the time. Let me know, because I would love to know how this has worked out for you. So understanding this a little bit more, T3 and T4 are going to be really important to check, again, because we need to see, are you actually making thyroid hormone? The TSH is going to be really important because it's going to kind of guide us to, is there an issue coming more from the brain, or is it more from the thyroid itself? And then as well as that reverse T3 and then those thyroid antibodies. You need to know what all of those are doing, because if you don't see an interaction with all of them, it's really hard to get a clear picture of what the thyroid is actually doing, of what you need to look into further. So one thing that I also do is I do the hair tissue testing, which is really common to see the minerals are way off and they're kind of driving the thyroid to slow down. And I see that very commonly as well being an issue where women are getting their blood panel and it actually does look okay. And I even look at it and their functional ranges look pretty good, but they're still feeling pretty crappy. So that's when I pull in their hair tissue testing. You can look at that as well. So if you want more information on this, reach out. Let me know if you want to get on the wait list for the guide, because I will have it so simply laid out for you, so that you always have it to reference, especially if you need to talk to your doctor. You can actually reference from that what the reference ranges are, what you need to have checked, and why they're so important. You need to have that full panel, because there's too many things that you could be missing when you don't get that full panel done. And there's too many things that you could be missing when you're not looking at more functional reference ranges. So again, let me know if you have questions. Subscribe to this page and go ahead and hit that bell so you get a notification every Thursday, as well as if you're watching this on Facebook or Instagram, I would really appreciate it if you could share this information, tag someone that might benefit from it. I hope this information helped you. Let me know if you want to get on the wait list, and we'll talk soon in the next video. Bye.